Like many low and middle income countries, equitable access to healthcare has been a national challenge for Ghana. The country is experiencing persistent regional disparities in the distribution of healthcare resources, particularly in rural communities. In rural Ghana, understaffing of health facilities and inadequate health infrastructure has created wide inequities in access to healthcare and health outcomes. The Upper West region is home to over 868,000 people and has the highest poverty incidence among all regions in Ghana, with approximately 70% of the population living below the poverty line. Like many rural communities worldwide, this region has faced major challenges in recruiting and retaining medical staff. In 2020, the entire Upper West region had a total of 66 physicians, putting the doctor-to-population ratio at a crisis level of 1 doctor for every 13,159 residents. This has led to a large portion of the population being denied basic health services. One factor contributing to the challenge of attracting and retaining healthcare workers in rural Ghana is a lack of opportunity for continued medical education. Continued medical education, otherwise known as CME, is the means by which members of the medical profession maintain, develop, and enhance their knowledge and clinical skills. The field of medicine is constantly changing, so it's important that clinicians have access to up-to-date information on current evidence-based practices to remain competent and provide quality medical care. Like all resource-limited communities worldwide, physicians in the Upper West region have little access to continued education and mentorship opportunities, since most CME programs have been geographically restricted to teaching hospitals in the urban South. Together, this has contributed to challenges in the recruitment of health workers in the rural north of the country. Expanding CME opportunities in rural communities is therefore a pivotal step towards improving health equity in these areas. In July of 2021, Ghana Medical Help launched the Community Service Agenda with the goal of improving access to continued medical education opportunities for health workers in the rural north of Ghana. This education program is a weekly, virtual Grand Rounds program and is open to all rural healthcare workers. The Community Service Agenda has been one of Ghana Medical Help's most successful initiatives. Over 98% of participants have told us that the program has been helpful to their clinical practice and that they would keep attending future seminars. Improved knowledge and clinical performance are the most cited benefits that participants report from attending the Grand Rounds presentations. And not only is our Grand Rounds program improving clinical competency and morale among healthcare providers in northern Ghana, but it is already contributing to reducing the region's shortage of healthcare workers. When the Grand Rounds program was launched in July of 2021, there were only 5 physicians working at the Upper West Regional Hospital. Only 1 year after the program first started, the number of physicians at this facility has over quadrupled, and nearly all attend the weekly Grand Rounds presentations. These new physicians have reported that they would have previously rejected northern job postings, but accepted it solely because of the ongoing learning opportunities now offered. More recently, due to the success of the program, the Ministry of Health in Ghana has approved Ghana Medical Help's Grand Rounds presentations for certified CME accreditation.